Assalamu alaikum. This is Sayyida Sadiqa Mehdi Zaidi, and the presentation topic for PhD 705 is rational and irrational use of drugs. And my given drug topic is ketamine. What is ketamine? Ketamine is a drug that belongs to the class of general anesthetics. It is a non-barbiturate dissociative anesthetic. It's a glutamate N-methyl D-aspartate receptor antagonist that is rapidly acting and used as anesthetic agent. It induces dissociative anesthesia, a trance-like state providing pain relief, sedation, and amnesia. Recent studies show that the sub-anesthetic infusion of ketamine is efficient for the treatment of depression. It can safely use in the wide age range. This is the benefit here that it can easily be used by any age group, and in children, they can easily be given the higher doses regardless of any severe side effects because they can metabolize the ketamine faster than the others. Indications. It is used for short-term procedural sedations, such as the reduction of fracture and dislocation, wound repair in uncooperative patients, rapid sequence intubations. Intubations are basically the examinations. They are the tubes that are entered from the mouth through the airway to check the breathing during the anesthesia. Painful diagnostic interventions, very useful in emergency department setting for all of these conditions. It is also used for the induction of anesthesia prior to the administration of IV anesthesia to potentiate the action of inhalation anesthesia of low potency, that is the nitrous oxide. Nitrous oxide is basically a weak anesthesia. So for maintaining its dose, so for maintaining its effect, the ketamine is using as a maintenance anesthesia. Other uses. It is used in the treatment-resistant depression. I have mentioned earlier that this research showed that the ketamine is very useful for treatment of the depression. It is used in emergency bronchospasm conditions. Its low doses is used either alone or in adjuvant to other pain relief medications such as the opioids and the NSAIDs to relieve low back pain, fractures, and other extremity pains. Its irrational use. It has been used recreationally as a drug of abuse, and if it is used for a longer period of time, it may cause dependence. How it is used? It is used as a club drug by mixing it with other liquids, that is marijuana or alcohol. Its street name is K or special K. Alternate. Ketamine is basically itself an alternate to the other intravenous anesthetics because of its unique property of analgesia, stimulation of sympathetic nervous system, bronchodilator, and minimal respiratory depression. Ketamine has a lot of useful effects. It has a lot of indications, so it is a good drug. Precaution. Should be administered slowly. A rapid administration or overdose may cause respiratory depression and incompatible with soluble barbiturates, that is the phenobarbital. Contraindications. Ketamine is contraindicated in patients with underlying conditions in which increased blood pressure would pose a risk of complications such as the aortic dissection, uncontrolled hypertension, myocardial infarction, or aneurysm. Toxicity. Ketamine is potentially fatal in the chronic alcoholics and acutely alcoholics intoxicated patients which are taking a lot of alcohols. So ketamine is fatal in those patients, and also it can increase the cerebrospinal fluid in those patients. Drug-drug interaction. Ketamine, if given with the other drugs, so the drugs names are the doxycycline, fentanyl, isocarboxylate, ivacaftor, phenylocypromine, resigline, norepinephrine. If given with these drugs, so it may cause toxicity side effects, or can lower the effect of ketamine. Side effects include the elevation of blood pressure, tachycardia, hallucination, psychomotor agitation, mental confusion. Antidote. Only supportive care is required for patients with the ketamine toxicity. There is no exactly antidote is available for the ketamine toxicity. So only supportive care is required for the patients. The effects of intoxication typically last for about 15 minutes to several hours. After relief of intoxication symptoms, monitoring of airway, breathing, and circulation for about 1 to 2 hours is required. Dosage. Adult IV dose is 1 to 4.5 mg per kg. And usual induction dose is 1 to 2 mg per kg. Average dose producing anesthesia of 5 to 10 minutes of duration is 2 mg per kg. Adult dose for IM is 3 to 8 mg per kg. The 10 mg per kg dose brings about anesthesia of 120 to 5 minutes duration. Children dose IV is 3 to 7 mg per kg, and for IM is 3 to 7 mg per kg, and for IV is 0.5 to 2 mg per kg. Use smaller doses for the sedation for minor procedures. Usual induction dose is 1 to 2 mg per kg, and continuous, if you are given continuous IV infusion, so 5 to 10 mcg per kg per minute is given, like the low dose is given for continuous. And for the maintenance dose for both adult and children is supplementary doses of 1/3 to 1/2 of the initial dose. Administration, like how it is administration, on for how much minutes, for with what kind of solutions it should be administered. So do not exceed 0.5 to mg per kg per minute or administer faster than 60 seconds. Do not exceed final concentration of 2 mg per ml. And we have to dilute it before administering IV with the normal saline and the dextrose water. Available dosage forms, it is only available in injectables. Different pharmaceutical industries are providing different strength of injection. Calypsol, Decad, and Entamine are the highest strength, that is the 500 mg per ml available. And the Ketamine, are the lowest strength, that is the 550 mg per ml available. If we look towards the retail price, that is the price. So the highest price is of the Catacil, that is 275 rupees, and the lowest price are of the Catalite, Catagen, and the Caliperol, that is the 25 rupees. Now the case study. A 59-year-old female patient was referred to a clinic with the complaints of anhedonia, boredom, and bulging in the stomach. She was anxious about not being able to feel better and had crying spells while we were at home. These complaints were triggered by daily stress. Her medical history was significant for long-standing major depressive disorder and the chronic anxiety. The treatment that the patient had received during her illness included the following: imipramine, doloxetine, quetiapine, citalopram, lamotrigine, paroxetine, bupropion, mianacerine, sulpirate, carbamazepine. The blood drug levels were checked regularly and they were all in the therapeutic range. And she was found to be sensitive to all psychotropic drugs after drug sensitivity tests. Because she did not benefit from these therapies, she was given 10 sessions of the electroconvulsive therapy, and due to lack of adequate response, 20 sessions of the transcranial magnetic stimulation was applied. 4 months after ECT, she had the same complaints and her symptoms worsened with even more suicidal thoughts, although she was taking her medications regularly. Her clinical global impression score was 6 and her Hamilton depression score was 32, but ECT stopped after the third procedure because the patient fell down and broke her hand. Soap noodles. Subjective. Age of the patient is 59 years and the gender is female. Her chief complaint was anhedonia, boredom, bulging in the stomach. Triggering factors was the daily stress. Her medical history includes the long-standing major depressive disorder and chronic anxiety. She was taking imipramine, doloxetine, quetiapine, citalopram, lamotrigine, paroxetine, bupropion, mianacerine, sulpirate, and carbamazepine. She was given 10 sessions of ECT and 20 sessions of TMS after failure of the holistic psychotropic treatment. Her Hamilton score was 32 after ECT. Review of symptoms: crying spells, feeling anxious, and suicidal thoughts. Objective includes the sensitivity test showed that the sensitivity of the patient towards the psychotropic drugs was examined. Assessment: patient is not responding to any medications or psychotherapy treatment as she is having treatment-resistant depression. Her clinical global impression severity scale was 6 and Hamilton's depression scale was 36. And she wasn't feeling any better, and worsened symptoms all are compatible with usual character of major depressive disorder, and also she has a medical history of major depression. So what plan we are given here is the ketamine infusion treatment, that is a 0.5 mg per kg IV for 2 weeks. Total 6 injections should be included in the regimen 3 weekly. Monthly maintenance infusion for 6 months. Notes: low doses of ketamine required to avoid the dependence. Monitor vital signs and cardiac function, blood pressure, pulse breathing and oxygen saturation always need to be monitored when using ketamine. References: so from the research article I have taken and Pharma Guide, and I have used the PubMed and CBI website. Thank you.